Good morning, good evening, respected judges. My topic is role of the continuous glucose monitoring in the glycemic control of diabetes patient in primary care, a study conducted in the coalfield area of Asansol and Raniganj in the West Bengal. So, overview on the prevalence. Diabetes is a severe chronic disease that arises when insulin generation is insufficient or the generated insulin cannot be used in the body, resulting in a long-term metabolic disorder that can be type 1, type 2 or gestational. According to the IDF 10th edition, the incidence of diabetes has been rising in the Southeast Asia for the last 20 years and the current estimates are outperformed the previous forecast. By 2020, the 643 million people will have diabetes globally, increasing to the 783 million by 2045. Now come to the most important part of the diabetes, that is the blood sugar monitoring. If we go to the blood sugar monitoring, that it was started in the 1800th century, the first urine glucose, then coming first CGM come in the 1999, then 2000 first real-time non-invasive glucose watch biographer was invented. Then 2004 Guardian real-time CGM machine, and then 2016 what we are using nowadays, that is Freestyle Libre Pro. What is CGM? The CGM is a method to track blood glucose throughout the day and night. CGM system takes the glucose measurement at regular interval 24 hours a day and translate the readings into dynamic data, generating the glucose direction and rate of the change. How it's work? It works the glucose level throughout the day. Actually, we insert a tiny sensor wire just under the skin using an automatic applicator. An adhesive patch holds the CGM sensor, holding them in place so sensor can measure the glucose reading in the interstitial fluid throughout the day and night. A reusable transmitter connects to the sensor wire and send real-time readings wirelessly to the receiver so the user can view the information. Although there is a two types, I will come to the later on. Next, with some system compatible smart device with CGM app can serve as the display device. The receiver or compatible smart device displays the current glucose level as well as the historical trends in level. The CGM receiver or compatible smart device can also be set to send the custom alert to user when the certain glucose thresholds are reached. Now, what is the benefit? A blood glucose meter only provides a brief snapshot of your glucose level. A CGM gives you a glucose trend. A CGM can provide the valuable information at crucial points during the day, including before exercise, prior diving, before test exam time, taking in the middle of the night. Now there is a differentiation in between the SMBG versus the CGM, but I'm not coming into the details of this. But the main thing, the SMBG is the static phenomenon, whereas the CGM is the dynamic phenomenon. And CGM still leaves the question, whereas still leaves the question. A CGM can provide the answer in a more compatible picture to allow the patient to make the best decision about their diabetes management. So this is the interpretations. Is a target above range, what is more than 180%. Target in range is 70 to 180, and target below range is less than 70%. So what are the candidate to whom we will use this? Any one patient, either type 1, type 2, even GDM, who wants to know what is the working best or not working for them. So we can use this device. The research methodology we have started there, that to assess the effectiveness of the continuous glucose monitoring system in improving glycemic control in the diabetes patient in the primary care setting, especially in the 100 centers in the Asansol coalfield area, we have used these systems in type 2 and type or 1 diabetes. Our randomized control trial was conducted involving 100 patients with type 1 and type 2 diabetes across the 10 primary care clinics in the Asansol Raniganj. Participants were randomly assigned to either CGM group or a control group using the traditional self-monitoring of blood glucose, and baseline measurement included HbA1c level, frequency of the hypoglycemic episode, and patient reported outcome on the quality of life. The follow-up assessment were conducted at 3 months, 6 months, and 12 months. So the selection of the study participants, the study involves 100 patients evenly distributed with 10 patients per clinic. It includes both type 1 and type 2 diabetes. Participants were randomly assigned to the continuous glucose monitoring group or the control group, where CGM uses the continuous glucose monitoring and control group uses the conventional SMBG technique. The baseline measurement I have already mentioned, the follow-up assessment to monitor the progress and impact of the intervention. The follow-up assessment were conducted at the distinct level at 3 months, 6 months, and 12 months. During this assessment, the same parameters measured at the baseline HbA1c, frequency of the hypoglycemic episode, and the quality of life. This periodic evaluation allowed the researchers to take changes over time to determine the long-term efficacy of the safety of CGM compared to the SMBG. So what was our result? Patient in the CGM group demonstrated a notable reduction in the HbA1c level compared to the CGM group, SMBG group. Specifically, CGM group report experienced a mean reduction of 1.2% in HbA1c level, while SMBG group had a mean reduction only of 0.6%. This significant difference with a p-value of less than 0.01 underscored the effectiveness of the CGM in better managing the blood glucose level among the patient with diabetes. The fewer hypoglycemic episodes was noted in the patient using the CGM group. The frequency of hypoglycemic episodes also significantly lower in the CGM group compared to the SMBG group. Patient using the CGM had an average 1.8 hypoglycemic episodes per month, whereas those who are using SMBG group average 3.2 episodes per month. And the improved quality of life and patient satisfaction. Patient reported the outcome from the trial revealed higher satisfaction and improved quality of life among the CGM users compared to those using SMBG. The CGM group reported the feeling more in control of their diabetes management, experiencing better overall well-being. The qualitative improvement suggests that CGM can positively impact the daily lives of the patient by providing more reliable and less intrusive monitoring, thereby enhancing their overall satisfaction and quality of life. This is the comparison of the mean HbA1c reduction and hypoglycemic episodes between the CGM and the SMBG group. So the conclusion, the study demonstrated the CGM system significantly improved the glycemic control and reduced the hypoglycemic episodes in the primary care settings. The CGM users also reported the greater satisfaction with their diabetes. These findings suggest the interacting CGM into primary care patients can enhance the more effective diabetes management and improve patient outcome. And these are the evidence by the Diamond study and evidence the meta-analysis. And so the take-home message, CGM and flash glucose monitoring, evolving technologies, CGM and FGM are beneficial in the selected populations and the situations. Variability is better captured in the dynamic monitoring, takes a new leap with the advent of AI. The advantage of macro and micro levels can be attained with the judicious uses. Thank you everybody for your patience hearing.